cardiac output. On completion of study of this chapter, the student must be able to define the cardiac output, appreciate the variation in cardiac output in different physiological conditions, list the method of measurement of cardiac output and learn the principle of common methods, describe the factors affecting cardiac output, explain the regulation of cardiac output. The student may also able to describe the measurement of cardiac output and explain the alternation cardiac output in different physiological and non-physiological related pathological condition. ठीक है, let's start. The primary function of the heart is to pump blood. The output of the heart maintains circulation, which is essential for supplying oxygen and nutrients to the tissue of the blood. Cardiac output, the output of each ventricle of the heart per minute provides the output of each ventricle of heart per minute. Cardiac output is per minute. Provide vital information about the condition of the heart to the patient, to the physician. Therefore, cardiac output assessment is a routine procedure in the assessment of cardiac health of the patient in medicine and cardiology clinic and in intensive care units. Nowadays, cardiac output measurement is performed routinely by ECG. कार्डियक आउटपुट किससे मेजर कर सकते हैं? ECG से. Therefore, cardiac output of each ventricle, the output of each ventricle of heart per minute provides vital information about the condition. ये लाइन यहाँ पे इम्पॉर्टेंट है, इसे पढ़ ले. That's all. Next move. Definition and factors affecting. Definition and normal values. Definition में we will learn definition and the normal values. Definition में क्या क्या आ जा रहा है? Definition. Cardiac output is defined as amount of blood ejected by each ventricle per minute. Each ventricle per minute. Cardiac output is about per minute. Amount of blood pumped. Amount of blood pumped or ejected by each ventricle per minute. Cardiac output is SV into HR. SV into HR याद रखना. कार्डियक आउटपुट इज स्ट्रोक वॉल्यूम इंटू HR. हार्ट रेट. हार्ट रेट क्या होता है? जनरली बोला जाता है 60 से 100, बट हार्ट रेट हम लोग लेते हैं 70. इन एन अडल्ट, हेल्दी अडल्ट में 72 लिया जाता है. नॉर्मल वैल्यू, नॉर्मल कार्डियक आउटपुट इन अडल्ट इज 5 to 6 लीटर पर मिनट. Per minute is important. Cardiac output is per minute. Approximately 8% of the body weight. Approximately 8% of the body weight. Stroke volume क्या होता है? Stroke volume is defined as volume of blood ejected by each ventricle with each beat. कार्डियक आउटपुट क्या था? ईच मिनट में कितना हो रहा था, 1 मिनट में कितना हो रहा था. एंड स्ट्रोक वॉल्यूम टॉक्स अबाउट ईच बीट. Normal volume, normal stroke volume is about 70 ml and normal cardiac output is 5 to 6 liter per minute. And here 5 about 70 ml. So if heart rate is 70 per minute, the cardiac output is 70 into 70, which is approx. We talked about cardiac output formula was SV into HR, right? And now we learned that SV is 70 ml, 70 ml and heart rate is 72 beats per minute. तो फिर अगर 1 मिनट में इतना हो रहा है और ये 1 बीट में इतना ml हो रहा है, 1 बीट में इतना हो रहा है, 1 मिनट में ये इतना हो रहा है,